Life is about moving forward. Mobility is an important factor that enables us to live life to the fullest and experience those special moments we often take for granted.
Nearly 21 million Americans suffer from osteoarthritis. Joining us is Dr. Jose Rodriguez, a leading orthopedic surgeon and published author, and orthopedic nurse Eva Riley. They're going to help us understand what osteoarthritis is and what we can do about it. Dr. Rodriguez, would you explain what osteoarthritis is?
Osteoarthritis is a disease in which cartilage in the joint deteriorates, resulting in pain and loss of movement as bone rubs against bone. It's a progressive disorder, and as a result, osteoarthritis patients resign themselves to living with pain and reduced mobility.
What are the people with osteoarthritis doing about it?
Many view the pain as just part of getting older, and often aren't aware of the gradual compromises that they make to accommodate that pain. For example, they might avoid going to the grocery store for fear of having to park far away from the entrance and having to walk across the parking lot to the store. Usually they recognize the impact that osteoarthritis has had when they acknowledge all that they've given up, thinking that there's nothing else they can do.
So most osteoarthritis patients just accept that they have to live with reduced mobility?
That's right, but there is something that they can do. They can take an active role in monitoring their own joint mobility by taking notice of the changes that they've made in their daily life to accommodate the pain and reporting these to their doctor, and by trying to preserve that mobility through activities such as exercise or physical therapy.
Ms. Riley, can you share how living with osteoarthritis impacts people's day-to-day lives?
Well, patients are certainly aware of the impact osteoarthritis has on their lives. In routine exams or when they visit the physician for another reason, patients will discuss the disease when it's brought up, but I don't think many patients proactively discuss the disease with their doctors on an ongoing basis, or even if there's slight changes. They usually accept slight changes in pain and the effects it has on their mobility. They may adjust their activities accordingly until all of a sudden they realize how much they've given up, and then they finally talk to their doctors about finding the right treatment approach.
Dr. Rodriguez, when a patient does talk to the doctor about osteoarthritis, what is generally the outcome of that discussion? Is there standard treatment? Is there behavior modification?
Interesting that you ask about behavior modification, since the person with osteoarthritis has probably already modified his or her behavior. One of the first modifications people feel forced to make is reducing or refraining altogether from exercise. This can sometimes lead to weight gain, which can have other effects on a person's physical and emotional well-being. There is a range of options for treating osteoarthritis, including over-the-counter products, prescription medications, and physical therapy, among others. They can reduce pain and inflammation. Physical therapy is an important tool in preserving mobility as it keeps the joints and muscles active and moving. When osteoarthritis becomes too debilitating, patients may undergo joint replacement surgery, which involves implanting a new surface to replace the worn and damaged cartilage.
Of all these options, which is standard?
There isn't one standard treatment approach. Treatment decisions are based on the severity of the disease, the individual patient, and prior approaches, among other factors.
So if someone is taking medication or involved in physical therapy but isn't experiencing pain relief, what should that person do, and when should he or she talk to the doctor?
Just as Dr. Rodriguez said, there are a variety of treatments for osteoarthritis. If a person's ability to complete even simple tasks such as tying shoes, rising from a chair, or climbing stairs is compromised, then they may want to discuss some of the other options with their doctor.
Normally, we recommend conservative treatments such as over-the-counter or prescription medications in combination with physical therapy.
There was mention before about people not talking to their doctors until they'd given up a lot in their lives. Is there something they can do to monitor their mobility so they can take action sooner rather than later and maintain their quality of life?
There are no specific guidelines, But patients can take a couple of minutes to assess their current level of mobility today compared to last year.
Are there any specific activities you would suggest?
Walking is one activity that can be seriously impacted by osteoarthritis. Often, without realizing it, patients with osteoarthritis gradually limit the distance they walk because of the pain they experience or the difficulty they're having when they're walking. Patients should think back. If they used to walk for exercise or pleasure, do they now limit the distance they walk or simply avoid it altogether? Driving is another activity which may cause trouble for osteoarthritis patients. They may have difficulty getting in and out of the car or while driving. Squatting can be one of the most difficult actions for people with osteoarthritis. As a result, many have given up on activities which involve this action. For example, gardening. Golf is another activity that can be impacted by osteoarthritis. Golfers may notice a change in how they play because the movement of swinging a golf club requires mobility in the knees, hips, and shoulders. Golfers may notice a difference in their ability to swing, their ability to play, and their score. If these activities cause significant pain, or if the patient has limited or discontinued these activities, they should discuss treatment options with their doctor.
Ms. Riley, what else should be considered?
Other signs that it may be time to discuss options with a doctor would be if medications no longer relieve pain, if pain persists even when the person with osteoarthritis is not active or when they're trying to sleep, if the osteoarthritis is keeping the person from visiting friends, shopping, or taking a vacation. Of course, if the person with osteoarthritis hasn't made too many compromises in their day-to-day activities, well, that's great. But they should continue to reflect on their activity levels and continue to engage in an active dialogue with their doctors about their pain and mobility levels. Also, if the pain persists and function decreases, the person with osteoarthritis should not put off exploring their options with an orthopedic surgeon.
When joint replacement becomes a likely possibility, we actually get the best results when patients are involved in physical therapy prior to the surgery, so that joint mobility and strength are preserved.
So people really don't have to live with the pain?
No, they don't, especially since they can do something about it.
There are a variety of joint replacement systems today designed to help increase mobility for active people. If you're someone who can benefit from joint replacements, don't delay. Consult an orthopedic surgeon who can help determine the best treatment option for you. Osteoarthritis sufferers have more options than ever to restore the joy of motion and the exhilaration of moving forward again. Rediscover your life. Restore the joy of motion. Presented by the National Association of Orthopedic Nurses and DePuy Orthopaedics, a Johnson & Johnson company.